My doctor's been very caring. When I needed an asthma machine, my doctor actually called at the house and wanted to make sure that my sons did receive the machine at home.
It's a lot of love here. The spirit of caring is here. And then number one priority here is to make sure that children are healthy.
Right now in HHC child health clinics all across New York City, babies, young children, and teens are getting vital health care services. From vaccinations and well care visits to the treatment of chronic conditions like asthma, all families have access to the finest healthcare system in the world. We're here for you.
Hello, I'm Dr. Max Gomez. As a medical reporter and a parent, I am proud to introduce you to a remarkable network of services. They're the child health clinics, operated by the New York City Health and Hospitals Corporation, known as HHC.
We really believe primary care is so important for the health of New Yorkers, and obviously we're very concerned about the health of the next generation of New Yorkers, our young children. Too often, the children of many New Yorker families, particularly recent immigrants, wind up going to the emergency room just to get care. And the child health clinics provide a medical home for children.
The HHC child health clinics cover all 5 boroughs: Brooklyn, Queens, Manhattan, Staten Island, and the Bronx. Each clinic is staffed by healthcare professionals who bring not just extensive medical knowledge, but compassion and deep dedication.
I love my job because I care for the kids and I care for the families in this clinic.
I've watched many of my children grow up from babies to young parents.
We do belong here. We need to be here to serve our communities.
Just keeping them healthy makes a difference in their life.
And HHC's child health clinics have been making a difference for more than a century. The year was 1908. The first Model T rolled off Henry Ford's new assembly line. The first skyscraper towered over Manhattan. And immigrants from around the world continued to pour into America through New York's Ellis Island. Many arrived with little more than the clothes they were wearing. They came to a city that was the gateway to opportunity. But it was a city that was crowded, dirty, and badly in need of social services, especially for the young. A milk epidemic would prove the tipping point.
People, and particularly children, were getting sick from contaminated milk. So the city established these special stations where families could go to receive pasteurized milk at no charge.
But it soon became clear that the city's children needed additional health services, and the milk stations were a natural place for that care. With free health care, the death rate among infants and children dropped dramatically. Over the years, HHC's child health clinics grew and evolved, becoming part of the community. From vaccinations and physicals in the early 1900s to well baby exams, and then treatment for pediatric illnesses later in the 20th century. They've become a place for children to go not just when they are sick, but also to stay healthy.
We offer preventive care to prevent patients from getting to that level where they need to end up going to the emergency room.
The child's health clinics are perfect models, examples, the real thing in being accessible in communities. Many of them are located in public housing developments where a lot of families live.
Everyone is welcome. There are options if you can't afford to pay. No one is refused treatment because they're not U.S. citizens, and all medical information is kept confidential, even for teenagers.
I feel comfortable referring families to the various child health clinics because of the comprehensive care they give.
I think it's also important to be socially and culturally appropriate and relevant, which means that you have people that speak the same language, that look like you, providing those services in your community.
Not just thousands, but tens of thousands have come to rely on HHC child health clinics to keep their families healthy. Over the years, child health clinics have become part of the fabric of New York's wide and varied communities.
I've been coming to the Melrose Child Health Clinic for over 12 years now. My children went here first, now my grandchildren go here.
My children been coming to the Sutter Child Health Clinic for 15 years. Before that, I was a patient.
I feel comfortable because I know Dr. Cannon, and it feels like I could tell her anything.
Ella es la doctora Las y yo soy la señora Serrano, que yo voy a ser tu intérprete hoy.
Language shouldn't be a hindrance to receiving services here at the clinics. We have people that speak many languages.
En español.
Sa wikang Pilipino.
En français.
廣東話
Hindi में
Bangla भाषाएं.
We provide continuous care, comprehensive care, and when we need to refer children out, we do, and we take care of all their needs.
A small clinic like this is more like a family interaction. You know people by names. You already know what their issues are. When they need something, they call on the phone. You really know them very, very well.
Where's my middle brother today? He's not here.
When some of the kids come in, they'll run up to me and give me a hug and kiss and know me by name, and that's very special.
It's important for New Yorkers to know that these clinics exist.
The caring that we give them and what they give us is beautiful.
I love my patients. I consider them part of my family.
The nurses really stand out to me because they really do help us.
I enjoy helping people and providing the care that they deserve and they need.
It's a great place. Doctors are very nice. People are wonderful here.
This is healthcare that is here for you and your family. Just call 311 to find the nearest HHC Child Health Clinic.